Hi class, so today we're here to talk about methamphetamine. What is methamphetamine? Crystal methamphetamine is a form of the drug that looks like glass fragments or shiny blush white rocks. It is chemically similar to amphetamine, a drug used to treat attention deficit and hyperactivity disorder and narcolepsy. Now, what is the history of methamphetamine? A Japanese chemist first synthesized methamphetamine, also known as meth, crack, crystal meth, and/or speed from another stimulant in 1893. Meth was used early on as a medical treatment for narcolepsy, asthma, and a weight loss drug. Meth was difficult to make until 1919 when another Japanese chemist, Akira Ogata, streamlined the process. He used phosphorus and iodine to reduce the amphetamine into a crystallized form, creating the world's first crystal meth. During World War II, the Allies and Axis powers both used the drug to keep troops awake. After the war, meth use increased dramatically even after it was outlawed by the United States in 1970. Now, how is it abused, and how does the drug affect the brain? Methamphetamine increases the amount of the natural chemical dopamine into the brain. Dopamine is involved in body movement, motivation, and reinforcement of rewarding behaviors. The drug's ability to rapidly release high levels of dopamine in reward areas of the brain strongly reinforces drug taking behavior, making the user want to repeat the experience. Now, some short term effects are increased wakefulness, increased physical activity, faster breathing, decreased appetite, rapid and/or irregular heartbeat, increased blood pressure, and increased body temperature. Now, how is it abused? Smoking, pills, snorting, injecting, all the bad stuff that we don't want. Some symptoms, meth mimics dopamine and it is taken into the cell by the dopamine transporters. Meth use can also alter judgment and decision making, leading to risky behaviors such as unprotected sex that can also increase risk for infection. Meth use causes changes in the brain's dopamine system that are associated with reduced coordination and impaired verbal learning. Now, some long term effects: severe dental problems, extreme weight loss, intense itching, anxiety, confusion, memory loss, violent behavior, paranoia, and hallucinations. Now, here I have shown some examples of methamphetamine uses. Now, on the top left, we see that there is dental problems, the teeth are decaying, rotting, all that bad stuff that we don't want to partake in. Here we have this lady, she looks perfectly normal, and then we see that after the methamphetamine use that she is frail, she has wrinkles, she has itchy skin, you can tell. Especially even the bottom left, they look like zombies, first of all. And the guy, he at age 23, he looked perfectly normal as well. And then after methamphetamine use, you see that the teeth and his gums are decaying. And you look much older than age 25. So that's not what we want. So what schedule does methamphetamine fall under? It falls under Schedule 2. But what is Schedule 2? Substances defined as drugs with a high potential for abuse, with potentially leading to severe psychological or physical dependence. Now, how does meth contribute to the function of our system? Once inside the cell, meth enters the dopamine vessels, forcing the dopamine molecules out. The excess dopamine in the cell causes the transporters to start working in reverse, actively pumping dopamine out of the cell into the synapse. The excess dopamine becomes trapped in the synaptic cleft. As a result, it binds again and again to the receptors, overstimulating the cell. So here we see that that dopamine is a neurotransmitter that's involved. Now, methamphetamine is highly addictive, like I said before. So some withdrawal symptoms include anxiety, fatigue, severe depression, psychosis, and intense drug craving. With a methamphetamine overdose, it often leads to a stroke, heart attack, and/or organ problem. With overdose deaths involving methamphetamine, which have raised within the past decade. So some treatments. This treatment is used to treat attention deficit hyperactivity disorder, which is also known as ADHD. Some behavioral therapies is the cognitive behavioral therapy, which also helps patients recognize, avoid, and cope with the situations to trigger drug use. There is also motivational incentives, which uses vouchers or small cash rewards to encourage patients to remain drug-free. Now here's a continuation. While research is underway, there are currently no government-approved medications to treat methamphetamine addiction. Also, research continues towards development of medicines and other new treatments for methamphetamine use, including vaccines and non-invasive stimulation of the brain using magnetic fields. People can and do recover from meth addiction if they have ready access to effective treatments that address the multitude of medical and personal problems resulting from long-term use. So here's another male who also is on methamphetamine use. And then also another lady. The dots on her face are actually from the severe itching. So I don't know if you guys noticed that in the previous pictures that I have shown, a lot of you can tell when a person is using methamphetamine when they have dots on their face, and that's just due to their severe itching. So when they are high on the drug, they actually have they're actually having going through severe itching, obviously. So, and then also here are my references. But this concludes the end of my presentation, and this is why we should say no to drugs.